Dr. Karpinos did his B of A at University of Michigan, his MD from Sackler School of Medicine in Tel Aviv, his residency at NYU, where he was chief resident in anesthesiology. His experience prior to the hospital, he was he was at Hackensack University Medical Center before joining SBH in 2013. His current position is chairman of Department of Anesthesiology, assistant vice president, and medical director of perioperative services. Rob is involved in all aspects of optimizing anesthesia services and perioperative care at SBH. He makes sure SBH is compliant with the multiple regulatory agency rules involving the OR. He does extensive and time-consuming committee work. As chair of Credentials Committee, he runs the monthly meeting and vets every physician, PA, NP applying to work at St. Barnabas Hospital. He's involved with the nominating committee. He chairs the opioid stewardship committee. He's significantly decreased opioid use throughout the institution. He champions the bloodless surgery program for specialized care to Jehovah's Witness here at SBH. He's also active on the transfusion, P&T, Team 1 committee, and he runs the moderate sedation committee. Although Dr. Karpinos spends most of his time on the second floor and in the ORs, he will come to floors at all hours to intubate during Team 1 and cardiac arrest, teaching residents and sharing his advanced airway skills with them. During the initial COVID pandemic, Rob was one of the key personnel at SBH, and I worked with him on a daily basis. I was able to see his tireless work ethic firsthand. Rob was involved with extended satellite ICU planning, organization, and management. He optimized the transition of the ambulatory surgery unit into an all-COVID ICU and oversaw management on a daily basis. Some examples of Rob's initiative in patient care occurred during the pandemic. One was with ventilators splitting. During the first pandemic, it looked like we would run out of ventilators at one point. We had only 2 left. Rob was quick to set up a vent splitting protocol and obtained all the needed pieces to make it possible, thus allowing for 2 people to use 1 ventilator. Yeah, a lot of work, a lot of time. Fortunately, we got a ventilator delivery at the last minute and didn't run out, but we were ready, thanks to Rob. He also arranged for a hyperbaric oxygen study in COVID patients to be done at SBH using the hyperbaric oxygen chamber we have on site to search for opportunities in advancing care and optimizing treatment in this new disease. Rob's also been one of the leaders involved in starting the new ECMO program at SBH. The ECMO program will advance the level of care given to patients in need here. By coincidence, the new ECMO program starts today. I have to admit, I'm my envy for Rob's lifestyle. Not the quality hard work and long hours he puts in at SBH, but the fact he rides to work on one of his motorcycles daily when the weather permits. Some of you may have seen Rob riding cross country with his daughter when he gets time off. He's actually, can I mention the Iron Butt Society? It's an award. He rides 2,000 miles in 48 hours. It's unbelievable. Dr. Shabsig was not able to be here today, and he sent a few words that I will read on his behalf regarding Rob. So this is from Ridwan Shabsig. Throughout my 46-year career in medicine, I have had the chance to work with a large number of wonderful people with amazing professional achievements. However, I can say with the highest unsolicited honesty that I have rarely had the distinct privilege of working with someone like Rob Karpinos, who combined a great bouquet of virtues, high medical knowledge of the anatomy, physiology, disease, pathology, superior skills in his specialty, excellent teaching approach, and brilliant managerial abilities. However, what impresses me the most about Rob is his tireless 24/7 availability, super dedication and loyalty to his job, mission, and his patients, his generosity with his time and effort. Throughout my tenure at SBH, I have worked very closely with Rob almost on a daily basis in his capacity as the Director of Perioperative Services. We naturally dealt with our agreements and disagreements with passion and persuasion. We shared good days and challenging days. We collaborated on dealing with all types of difficulties and shortages. The climax of our collaboration was during the COVID health crisis of 2020. I, like many of my colleagues, have learned to love him and respect him, and it has been my great fortune to get to know him and my honor to work with him. The The Medical Staff Impact Award reads, to recognize this medical staff member who consistently achieves high standards in the practice of medicine, positively impacts his fellow colleagues, and is looked upon as a role model and leader by his peers, it is my honor and pleasure to present the 2020 Medical Staff Impact Award to Rob Karpinos.